Jayden growing up was just like any other kid. He was hitting all his milestones, he was starting to walk, starting to talk, before his epilepsy anyway. He was diagnosed when he was 12 months, so prior to him actually being diagnosed with epilepsy, everything was just like you would expect from a normal child. I remember the day that he was discharged from hospital and the doctor had turned around to him and said, just put him on the medication and you'll never see a seizure again. They couldn't have been more wrong. Jayden's development stopped. He stopped progressing. He was seizing up to 300 times a day. Life was just one whirlwind of seizures and recovery and appointments and medications, and nothing like what I would have thought of when we left hospital that first time. It just went downhill and downhill fast. Jayden overall had 16 different medications. He had steroids, he tried diets twice. He had IVIG. 99% of his medications would knock him out. Just completely exhausted and tired and barely able to function. So if he wasn't recovering from seizures and tired, he was tired from all the medication he was on. The side effects were horrendous. To be perfectly honest, I don't think many people thought Jayden had much of a future. It's really tough. I mean, as a parent, you don't want to see your child go through anything, and you do anything to take it away from them. Being so helpless and constantly living on the edge and waiting for that next seizure to hit or that next injury, that was just impossible. The neuro suggested trying either a VNS or trying corpus callosotomy. So the corpus callosotomy is where they separate the two halves of the brain, and I didn't want to do that to him. That was a very, very, very last resort, and the VNS was the lesser of the two. Next month will be 3 years seizure free. That's gonna make me cry thinking about just how far he's come. He can talk. He could never talk before, and now I'm having conversations with him. Hearing him run up to me and say, "Mom," it's something that I never thought he would do. He's just come leaps and bounds, and you can go back 3 years. I didn't know my son. When he was having seizures, it was either having a seizure or recovering from a seizure. And now we get to go and play, we get to go and do stuff. I don't have to worry if I want to take him to the grocery store. I wish that the VNS was offered to parents earlier. If the VNS can have this much of an impact on Jayden, I'm sure that it can have that much of an impact on other parents and their kids. I love being a mum now. It was tough at first. It was very tough. Now I wouldn't change him for the world. He's spectacular.
VNS therapy is indicated for use as an adjunctive therapy in reducing the frequency of seizures in patients whose epileptic disorder is dominated by partial seizures, with or without secondary generalization, or generalized seizures that are refractory to seizure medications. The Model 106 Aspire SR seizure response features the automatic stimulation mode, which is intended for patients who experience seizures that are associated with cardiac rhythm increases known as ictal tachycardia. The VNS therapy system cannot be used in patients after a bilateral or left cervical vagotomy. Do not use short-wave diathermy, microwave diathermy, or therapeutic ultrasound diathermy on patients implanted with the VNS therapy system. Diagnostic ultrasound is not included in this contraindication. Cardiac arrhythmia. Model 106 only. The auto-stim mode feature should not be used in patients with clinically meaningful arrhythmias or who are using treatments that interfere with normal intrinsic heart rate responses. Physicians should inform patients about all potential risks and adverse events discussed in the VNS therapy physician manuals, including information that VNS therapy may not be a cure for epilepsy. Since seizures may occur unexpectedly, patients should consult with a physician before engaging in unsupervised activities such as driving, swimming, and bathing, or in strenuous sports that could harm them or others. A malfunction of the VNS therapy system could cause painful or direct current stimulation, which could result in nerve damage. Removal or replacement of the VNS therapy system requires an additional surgical procedure. Patients who have pre-existing swallowing, cardiac, or respiratory difficulties, including but not limited to obstructive sleep apnea and chronic pulmonary disease, should discuss with their physicians whether VNS therapy is appropriate for them, since there is the possibility that stimulation might worsen their condition. Post-operative brachycardia can occur among patients with certain underlying cardiac arrhythmias. MRI can be safely performed, however, special equipment and procedures must be used. Magnetic resonance imaging, MRI, should not be performed with a magnetic resonance body coil in the transmit mode. The heat induced in the lead by an MRI body scan can cause injury. Additionally, in vitro tests have shown that an intact lead without an implanted pulse generator presents substantially the same hazards as a full VNS therapy system. If an MRI should be done, use only a transmit and receive type of head coil. MRI compatibility was demonstrated using 1.5T and 3.0T MR systems. Consider other imaging modalities when appropriate. Procedures in which the radio frequency RF is transmitted by the body coil should not be done on a patient who has the implanted VNS therapy system. Thus, protocols must not be used that utilize local coils that are RF receive only, with RF transmit performed by the body coil. Note that some RF head coils are receive only, and that most other local coils, such as knee and spinal coils, are also receive only. These coils must not be used in patients with the implanted VNS therapy system. The VNS therapy programming system, including the programming wand and the programming computer, are MR unsafe. The patient magnet is also MR unsafe. These devices must not be brought into the MR scanner room. See the MRI with the VNS therapy system chapter of the Physician's Manual, non-US version, for details. The most commonly reported side effects from stimulation include hoarseness, voice alteration, paresthesia, prickling feeling in the skin, dyspnea, shortness of breath, sore throat, and increased coughing. The most commonly reported side effect from the implant procedure is infection. The information contained here represents partial excerpts of important prescribing information from the product labeling. Patients should discuss the risks and benefits of VNS therapy with their healthcare provider. Visit www.vnstherapy.com for more information.